Prime Minister Narendra Modi holds a meeting with Chief Ministers of States through video conferencing, calls on states and centre to work together. Meanwhile, the number of confirmed COVID cases rises to 236 in the country. In a major announcement to fight coronavirus, no passenger train will originate from any railway station in the country starting tonight at midnight to 10 p.m. on Sunday. Main and express trains will also stop services from 4 a.m. on Sunday. The Prime Minister thanks the people from different walks of life for supporting the cause of Sunday's Janata Curfew. Influencers and achievers from various fields and several organizations have come out in support of the Janata Curfew. States take major steps to prevent coronavirus spread. Mumbai, Nagpur, Pune and Pimpri Chinchwad to remain closed in Maharashtra till the 31st of March. Exemption for essential services, banks, grocery stores and medical stores. All malls closed in Delhi till the 31st of March. All markets in Delhi will be closed for the next 3 days. No metro services on Sunday. Section 144 imposed in Haryana. Prime Minister Modi thanks the PM of Bhutan, Dr. Lote Tshering, and PM of Nepal, KP Sharma Oli, for contributing in COVID-19 emergency fund. Says it's wonderful to see SAARC leaders taking initiatives that are adding strength to the collective fight against coronavirus. Coronavirus continues to spread across the world. More than 2.5 lakh infection cases and death toll more than 10,000. Italy records 627 deaths, taking the toll over 4,000 in that country. France reports 78 more deaths in 24 hours. UN chief warns that global recession is a near certainty. Namaskar, you're with the latest here on DD News and DD India. I'm Gautam Roy. Prime Minister Narendra Modi on Friday held a video conference with chief ministers of different states to assess the preparations being made by them in the fight against coronavirus. The central government has been making every effort on war footing to overcome COVID-19. The risk profiling of passengers has been expanded to include all passengers from Australia, UK as well as the US.
Prime Minister Narendra Modi held a video conference with chief ministers of various states and deliberated on ways to check the spread of the virus. Union Health Minister Dr. Harshvardhan and top health ministry officials were also present in the meeting held via video link. Prime Minister said that the threat of the pandemic is common for all states and underscored the need of centre and all states working together. He said that while participation of citizens is necessary to combat the challenge, panic needs to be avoided. He added that given the global context of the spread of the virus in various countries, constant vigilance is of paramount importance. He said that the next 3 to 4 weeks are crucial in efforts to contain the spread of the virus, and the most important measure for containment is social distancing. He requested the chief ministers to ensure effective implementation of the same. The chief ministers briefed the Prime Minister and others about the preparations done till now. They requested for augmentation of testing facilities, greater support to vulnerable sections, advancement of financial disbursement for 2020-21 to the states, and requested for roping in private labs and hospitals in larger numbers. All the chief ministers assured their support and reaffirmed that all states will work together with the Government of India to combat the pandemic. They thanked the Prime Minister for the support given by the centre and also appreciated the impact of Prime Minister's message in his address to the nation. Prime Minister in turn appreciated the steps taken by states and thanked them for sharing their experiences and giving suggestions. He stressed on the urgent need of capacity building of healthcare workers and augmentation of healthcare infrastructure. He suggested that the chief ministers should do video conference with trade bodies in their states to prevent black marketing and undue price rise. He urged them to use soft power of persuasion as well as legal provisions wherever necessary. Earlier in Lok Sabha, Union Health Minister Dr. Harshvardhan reiterated that there is no community transmission of the virus in the country. All known best practices have been put into action to tackle the challenge.
Infection in this country, you see, it is traveling from one person to other. It has not yet gone into the community. Even for the community also, separately, the ICMR is doing tests for picking up people from the community to see whether there is any evidence of transmission in the communities.
Government is laying maximum emphasis on social distancing. Advisories have been issued to cut down on use of public transport and to maintain distance between passengers while travelling.
एक मुख्य अंश ये भी था सोशल डिस्टेंसिंग के रूप में कि जो हमारे मोस्ट वल्नरेबल, जो हमारे एल्डरली हैं, सीनियर सिटीजन्स हैं और इसी तरह से जो छोटे बच्चे हैं, हमने उनको, माननीय प्रधानमंत्री जी ने भी उनको रिक्वेस्ट की थी, उनको कहा था कि आप कृपया आने वाले कुछ समय तक अपने घर में रहें, जब तक कि आपको कोई मेजर कार्य ना हो, बाहर ना जाएं.
Steps to tackle the COVID-19 challenge are being taken on a war footing. With Bureau Inputs, DD India.
Let me take you across to my colleague Nitendra Singh joining me on the phone line. Nitendra, what is the latest as far as the spread of COVID-19 and the battle against is concerned? Because right now we're looking at a situation where a lot of cities are announcing some kind of closures for a specific period. It could be till Sunday or even till the 31st of March.
देखिए गौतम, एक तरह से प्रधानमंत्री के अपील के बाद काफी कुछ बदलाव आया है, काफी कुछ फर्क पड़ा है और कई राज्यों ने बहुत कड़े कदम उठाए हैं. खासतौर पे महाराष्ट्र, दिल्ली और बाकी दूसरे राज्य ने भी कदम उठाए हैं कि जो शहरों को बंद करने की कोशिश की है. जितनी भी दुकान है, अगर दिल्ली की बात करें तो 21, 22, 23 को जितने भी बाजार है उनको बंद रखने का एक तरह से ऑर्डर दिया गया है. इसके अलावा महाराष्ट्र में भी सभी दुकानों को इसेंशियल सेवा को छोड़ करके बाकी दुकानों को बंद रखने का आदेश दिया गया है. तो ये एक जरूरी इसलिए भी है क्योंकि लोग सोशल डिस्टेंसिंग का जो एक गाइडलाइन है उसको पालन करें और लोग घरों से ना निकले. जितना कम निकलेंगे घरों से उतने इस चेन को तोड़ने में कामयाबी मिलेगी, क्योंकि अभी तक कम्युनिटी में प्रसार इसका नहीं है. सिर्फ उन लोगों को संक्रमण है जो लोग विदेश से आए हैं या फिर उनके क्लोज रिलेटिव हैं, और इस प्रसार को आगे न बढ़ने दिया जाए. इसलिए बहुत जरूरी है कि सोशल डिस्टेंसिंग को मेंटेन किया जाए. इसलिए तमाम कदम उठाए जा रहे हैं. कल प्रधानमंत्री ने भी लोगों से अपील की है कि आप जनता कर्फ्यू का पालन करें और सुबह से लेकर के 7 बजे से लेकर के रात 9 बजे तक एक तरह से घरों में रहने की अपील की है. और देखते हैं कि पूरे देश में कल की जो हम लोग फीडबैक लिए थे, पूरे देश में इसका स्वागत किया गया है. सभी लोगों ने प्रधानमंत्री के इस अपील का स्वागत किया है और इसलिए किया है क्योंकि लोगों को पता है कि अगर सोशल डिस्टेंसिंग बनाए रखेंगे, अगर एक हफ्ते तक अपने घरों में रहेंगे, परिवार के साथ रहेंगे, तो खुद को सबसे पहले बचाव करेंगे, क्योंकि इस बीमारी से बचना बहुत जरूरी है, संक्रमण से बचना बहुत जरूरी है. और सबसे पहले अगर आप बचेंगे तो आपका परिवार बचेगा, फिर आपके पड़ोसी बचेंगे और फिर समाज और देश बचेगा. और दुनिया भर में बेस्ट प्रैक्टिस यही है.
हाँ, लेकिन नितेंद्र, यहाँ जो भीलवाड़ा की जो स्थिति है वो कुछ चिंताजनक लग रहा है कि बनती जा रही है, क्योंकि कर्फ्यू तो वहाँ लगाया गया जिसके बाद एक डॉक्टर पॉजिटिव पाए गए, लेकिन उसके बाद और लोगों में भी ये इन्फेक्शन डिटेक्ट हुआ है, कन्फर्मेशन हुआ है. 3 और डॉक्टर और 3 कंपाउंडर भी बताए जा रहे हैं.
देखिए, जो सबसे बड़ी बात ये कही जा रही है कि जब भी लोग संक्रमित देश से आ रहे हैं तो वो अगर घर में क्वारंटाइन का पालन नहीं करेंगे तो निश्चित तौर पे प्रसार बढ़ेगा. और यही सब देखने में आ रहा है. अब तक जितने केस आए हैं गौतम, कि वो जो लोग बाहर से आए हैं संक्रमित देश से, उनको ये नहीं पता चल रहा है कि वो संक्रमित है, क्योंकि इंक्यूबेशन पीरियड 14 दिन का है. और इस 14 दिन में वो कई लोगों से मिल रहे हैं, कभी अस्पताल चले जा रहे हैं, कभी डॉक्टर से मिल रहे हैं या फिर अपने रिश्तेदारों से मिल रहे हैं या कोई पार्टी कर रहा है. कनिका कपूर का जो मामला आप देखेंगे, लखनऊ में काफी हाई प्रोफाइल मामला हो गया. उन्होंने 3 से 4 पार्टियां अटेंड की हैं. वो ब्रिटेन से लौटी थी और उसके चपेट में कई पूर्व मुख्यमंत्री हैं और बाकी कई सांसद भी चपेटे में आ गए हैं, उनके संपर्क में हैं. उन तमाम लोगों को अपने आप को होम क्वारंटाइन कर लिए हैं. तो ये बहुत बड़ी सबक है लोगों के लिए कि आप अगर विदेश से आए हैं, संक्रमित देश से आए हैं, भले ही आपको लक्षण न दिखे तो आप घर में क्वारंटाइन रहें 14 दिन तक. अगर आपको कोई लक्षण दिख रहा है तो निश्चित तौर पे आप हेल्पलाइन पे, जो गवर्नमेंट का स्वास्थ्य मंत्रालय के हेल्पलाइन लाइन पे संपर्क करें या निकटवर्ती डेजिग्नेटेड हॉस्पिटल में जाएं. और अगर ये काम नहीं करेंगे तो लोगों में फैलता जाएगा, संक्रमण होता जाएगा. और चाहे वो भीलवाड़ा हो या बाकी दूसरी जगहों में यही सब केस देखने को मिल रहा है. और इसीलिए बार बार स्वास्थ्य मंत्रालय की तरफ से अपील की जा रही है कि आप प्रोटोकॉल का पालन करें.
Definitely, and that is the biggest takeaway that can be there for anybody in the country right now, because it is really important to practice social distancing and to basically take yourself out from intermingling with the general populace to the extent possible. Let me also now go across to Vishal Baristo, my colleague, who's been tracking what has been happening in Rajasthan, particularly in Bhilwara, where prohibitory orders under Section 144 of the CRPC have been imposed in Bhilwara district in Rajasthan starting Friday onwards, and that's because one doctor was found to be COVID-19 positive yesterday, and thereafter the situation has been growing a little more as a matter of concern. Vishal, what is the latest that you have? I believe more people have been tested positive.
Well, absolutely. Good morning to you, Gautam.
Morning.
Six people have been tested positive, and that includes six doctors and, I beg your pardon, three doctors and three compounders. Three compounders are the paramedical staff, and it's a grave situation there because this doctor who got infected through one of his guests from Saudi Arabia, and he had passed on the infection to two more fellow doctors. Now, the situation is very, very serious in Bhilwara, and that is why it has been locked down. And 6,000 patients who were in contact with this doctor, who came in contact with this doctor on between 22nd of February to 19th of March at Bangar Hospital in Bhilwara. They are also being screened, and situation is very serious there. And let me also tell you, Gautam, that two people have also tested positive in the Vaishali Nagar area of Jaipur, and after that there has been a Janata Curfew in the Vaishali Nagar area. Though the Janata Curfew starts from tomorrow, but people have already started home quarantine, and that is the situation here. In the last 24 hours, Rajasthan has had eight positive cases of COVID-19. Gautam?
And Rajasthan also has a former chief minister self-quarantining herself. Is everything okay on that front, Vishal?
Yeah, Vasundhara Raje tweeted that she and her son, along with her daughter-in-law, they had visited Lucknow in a party of Akbar Ahmed Dampi, the former Congress leader, and there they met this singer Kanika Kapoor, who tested positive. Now, somehow she dodged the screening and all, and she was there. But fortunately, both she, her son, and her daughter-in-law, they are all well. They have tested negative, and they have home quarantined themselves as precautionary measures. But as far as Jaipur is concerned, situation is fast turning from bad to worse because the SMS hospital, which is the largest hospital in the state, also there are news that some cases of positive people, they had visited the general ward, and that is why now the authorities are contemplating of shifting out all the patients, and now they are looking for dharmshalas because there is no more space there at the SMS hospital. So a lot of screening needs to be done, and experts are saying that home quarantine is the best medicine as far as the situation is concerned.
Yes, that is an alarming situation indeed. Let's hope that the situation remains under control and it does not become unmanageable, especially the one that is developing in Bhilwara. Thanks a lot for joining us for the moment, Vishal Baristo. Now, Prime Minister Narendra Modi has hailed the efforts of people from various walks of life who have come together to support the initiative of Janata Curfew this Sunday, that is the 22nd of March. It's an effort to contain the spread of coronavirus. Influencers and achievers from various fields and several organizations have come out in support of the Janata Curfew and have urged the nation to come together to make it effective. In a major announcement, Indian Railways has said that no passenger train will originate from any railway station in the country from midnight tonight till 10 p.m. on Sunday. Mail and express trains will also stop services from 4 a.m. on Sunday. All suburban train services will be reduced to a bare minimum as well. Passenger train services already on run will be allowed to run to their destinations. The IRCTC has also ordered the closure of all onboard catering services in mail or express trains from the 22nd of March, which is Sunday, until further notice in view of the coronavirus outbreak. IRCTC has also decided to close all food plazas, refreshment rooms, Jan Ahars and cell kitchens until further notice. The static units supplying meals to prepaid trains which are in operation may continue to operate. The onboard catering services in mail express trains and TSV trains should be closed until further advice. Let me take you across to my colleague Abhishek Singh on the phone line for this. Abhishek, these are extreme precautionary measures as well, but as far as train services go, traffic has been declining. It's been reduced over the last couple of weeks as well. People have also been cancelling a lot of their tickets, haven't they?
बिल्कुल गौतम, देखिए कोरोना वायरस के संक्रमण के से जो फैलाव है उसको रोकने के लिए रेलवे ने ये काफी बड़ा एहतियातन कदम उठाया है। अभी पिछले दिनों जो है रेलवे ने 155 ट्रेन कैंसिल किए थे, यानी अप एंड डाउन ट्रेन की अगर संख्या ले ले तो तकरीबन 310 ट्रेन को कैंसिल किया गया था। और इसी तरीके से देश के अलग अलग जोन्स में रेलवे जो कि 17 जोन्स में बटा हुआ है, वहां पर भी जीएम डीआरएम को ये ऑर्डर दिया गया है कि वो अपने हिसाब से देखे कि ऑक्यूपेंसी लेवल अगर लो है तो वहां पर ट्रेन सेवा को रद्द किया जाए, टर्मिनेट किया जाए। साथ ही इसके साथ जो रेलवे ने कल 4 बड़े अहम फैसले लिए हैं कोरोना वायरस को लेकर के। सबसे पहला जो फैसला रहा वो ये रहा कि जो भी मेल एक्सप्रेस ट्रेन है उनको जनता कर्फ्यू के मद्देनजर वो बंद रहेंगी आधी रात 21 तारीख की आधी रात तकरीबन 12 बजे से लेकर के अगले दिन यानी 22 मार्च को रात 10 बजे तक। लेकिन जो ट्रेन इसके अलावा जो ट्रेन जिसपे कि प्रीपेड आपने दिया हुआ है, खाने के लिए आपने पेमेंट की हुई है, उन ट्रेन सर्विस में खान पान की सेवा रहेगी। लेकिन इसके साथ साथ सारी ट्रेन में आईआरसीटी की ओर से जितने मेल ट्रेन हो, पैसेंजर ट्रेन हो, इन सब जगह पर जो है वो खान पान की सेवा को तत्काल रोक दिया जाएगा। इसके अलावा सब अर्बन ट्रेन जहां पे जो 4 बड़े जो जोन्स हैं, डिवीजन है, चाहे वो हम बात करें दिल्ली की बात करें, चेन्नई की बात करें, मुंबई की या फिर सिकंदराबाद की, जहां पे सब अर्बन ट्रेन से जहां की लाइफलाइन मानी जाती है, उनको आंशिक रूप से चलाने की बात कही गई है। जो एसेंशियल जहां पर बहुत ज्यादा जरूरत है वो वहां के डीआरएम को कहा गया है कि वो डीआरएम अपने विवेक से वहां पर देखे कि अगर फुटफॉल कम है, ऑक्यूपेंसी कम है तो उस हिसाब से वो ट्रेन को चलाए। इसके अलावा इसके साथ साथ जो आईआरसीटीसी ने जितने भी प्लेटफॉर्म है वहां पर फूड प्लाजा, रिफ्रेशमेंट रूम्स, जन आहार केंद्र, सेल किचन, इस तरह की जितनी सेवाएं हैं उसको बंद करने का काम किया है। और पैसेंजर ट्रेन को भी 22 मार्च को जो है वो नहीं चलाया जाएगा, लेकिन जो पहले से ओरिजिनेट हो चुकी है वो ट्रेनें जरूर चला करेंगी।
As much precaution as can be observed is being observed by the Indian Railways as well. Thanks a lot for joining us with that update. Now, total number of confirmed cases of COVID-19, including foreign nationals, has risen to 236 in the country. 23 people have recovered after treatment, while 4 deaths have been recorded across the country. Maharashtra has the maximum number of positive cases so far. Amid growing concern over the spread of coronavirus, Chief Minister Uddhav Thackeray has announced that all workplaces in major cities in Maharashtra, including Mumbai and Pune, will remain closed till the 31st of March. The shutdown will be applicable in Mumbai, Mumbai Metropolitan Region, Pune, Pimpri Chinchwad and Nagpur. Essential services will remain open, which include food, milk and medicines. Banks will also remain functional. And in the national capital, Delhi government has decided to discontinue its non-essential services till the 31st of March and allow workers of such departments to work from home. Orders have been issued under the Epidemic Regulation Act for closure of all shops in shopping malls in Delhi till the 31st of March, except shops dealing with items of daily needs. The DMRC has announced that in view of the Janata Curfew on Sunday, there will be no metro services on that day. Meanwhile, the Haryana government on Friday asked all the deputy magistrates and commissioners of police of the state to invoke Section 144 as precautionary measure to prevent the spread of COVID-19. The Uttarakhand government has also banned the entry of domestic and foreign tourists into the state till further orders to contain the spread of coronavirus. Uttarakhand is the second state to do so after Sikkim. Meanwhile, singer Kanika Kapoor, who had attended several gatherings in Lucknow and tested positive for coronavirus, has been booked for negligence and disobedience to the order issued by a public servant. Prime Minister Narendra Modi has appreciated Nepal's PM KP Sharma Oli's announcement of a contribution of 10 crore Nepalese rupees to the COVID-19 emergency fund. In a tweet, the PM said, and I quote, "Deeply appreciate PM KP Sharma Oli's announcement of contribution of NPR 10 crores to the COVID-19 emergency fund. It reflects Oliji's commitment and support to the collective fight of SAARC countries against the pandemic." And the PM has also appreciated Bhutan's Prime Minister Dr. Lote Tshering. In a tweet, the PM said, and I quote, "Gratitude to PM Bhutan Dr. Lote Tshering for his decision to contribute $100,000 to the COVID-19 emergency fund on behalf of the Bhutanese government. It's wonderful to see SAARC leaders taking initiatives that are adding strength to to the collective fight against coronavirus. University Grants Commission Chairman Professor D.P. Singh has appealed to the teaching community to come together and spread awareness among the society on the menace of COVID-19. He hoped that the academic fraternity will be together in the fight against COVID-19.
संकट की इस घड़ी में मैं देश के सभी विश्वविद्यालयों के माननीय कुलपतियों, अपने लगभग 40,000 महाविद्यालयों के प्रधानाचार्यों एवं 14 लाख शिक्षकों, गैर शिक्षक साथियों तथा 3 करोड़ 74 लाख विद्यार्थियों से अपील करता हूं कि वे धैर्य बनाए रखें और सभी सावधानियां बरतते हुए अपना बचाव करें। मैं आपसे यह भी अपील करता हूं कि अपने परिवार के सदस्यों, संबंधियों, मित्रों, सहयोगियों और समाज के सभी वर्गों को जागरूक बनाकर उन्हें भी इस वैश्विक महामारी से बचाने में सहायता करें।
The government has taken further preventive measures to achieve social distancing to contain the novel coronavirus outbreak. The government has decided to grant commuted leave without reduction of medical certificate to those officials who are above 50 years of age and have underlying conditions like diabetes, respiratory problems and other life-threatening illness for a period of till the 4th of next month. The decision has been taken to avoid unnecessary burden on the healthcare system. The DOPT in its order said that the officials appointed as consultants and advisors after their retirement who are at the age of 60 years and above may be allowed to work from home with the permission of the head of departments without adversely affecting their consultancy fee till the 4th of April. Besides, the contractual and outsourced staff may also be allowed to attend office on rotational basis without deduction of any wages for their absence from work up to the 4th of April. And due to the prevailing conditions caused by the novel coronavirus, as a precautionary measure, the Union Public Service Commission has deferred the personality tests, that is interviews, of the candidates for the Civil Service Main Examination 2019, scheduled from the 23rd of March till the 3rd of April, until further orders. New dates for the personality tests will be informed to the candidates in due course. Now, COVID-19 continues to spread across the world. More than 2,42,000 cases have been reported, while around 10,000 people have lost their lives due to the COVID-19. Italy already is the worst affected country in the world, as it has added another 627 fatalities, taking its reported total past 4,000 despite government efforts to stem the pandemic spread. The nation now accounts for 36.6% of the world's coronavirus deaths. Brazil has declared a state of emergency on Friday, allowing the government to free up budgetary resources to combat the virus that has killed 6 people and infected 621 in the country so far. Responding to the growing coronavirus crisis, the U.S. on Friday strengthened its emergency and relief measures to combat the toughest public health challenge in decades. More than 230 Americans have lost their lives till Friday evening due to the coronavirus outbreak, and the number of confirmed cases has jumped to over 18,000, an increase of over 10,000 in less than 50 hours. France has reported 78 more deaths from the coronavirus over the last 24 hours, bringing the total death toll from the outbreak in the country to 450. Zimbabwe has confirmed its first case of coronavirus as the pandemic reaches a health system that has nearly collapsed amid an economic crisis. The infected man lives at the Victoria Falls, one of the most visited tourist destinations in Africa. Zimbabwe is just days ago declared a national disaster. United Nations Secretary General Antonio Guterres, in a video message, has called for solidarity, hope and political will to see this crisis through, which has been triggered by COVID-19. He talked of the need for global cooperation in the fight against COVID-19.
We are facing a global health crisis unlike any in the 75-year history of the United Nations. People are suffering, sick and scared. A global recession, perhaps of record dimensions, is a near certainty. This is a moment that demands coordinated, decisive and innovative policy action from the world's leading economies. We must recognize that the poorest countries and most vulnerable, especially women, will be the hardest hit. This is above all a human crisis that calls for solidarity. In managing it, we also have a unique opportunity. Done right, we can steer the recovery towards a more sustainable and inclusive path. I call on all leaders to come together and offer an urgent and coordinated response. And the United Nations will support all governments to ensure that the global economy and the people we serve emerge stronger from this crisis. More than ever before, we need solidarity, hope, and the political will to see these through together.
The World Health Organization has warned that young people are not immune from coronavirus and must avoid socializing and communicating it to older, more vulnerable people. WHO chief's remarks follow reports that young people in many countries are being complacent about health warnings because of the greater susceptibility to the virus among older patients. And that's all we have for the moment in this edition of the news. The latest current news right here on DD News and DD India. Keep watching.